from farmers we work with directly. The Hemp House on the North Shore, Ooltewah, Eastridge, and Hickson.
So we know this is a time of year when all of us probably want to look and feel our best. And this morning, we have taken a road trip of sorts, and we are up in Cleveland at the newest location, the fourth one, of Refined Looks here in Chattanooga, plastic and cosmetic surgery, talking with two of their doctors, Dr. Jason Rehm and Dr. Brandon Boyd. Good to see you.
Nice to see you.
Thanks for coming on.
Of course, we'll be able to talk a little bit in the conversation about the looking good part, because y'all do that for people every day. But what folks don't always realize is that there's also the functionality of life that you help people with here on the plastic surgery side. Specifically, both of you are hand specialists.
Right, so we do. I mean, plastic surgery does cover reconstructive surgery and also cosmetic surgery. So you mentioned the looking good and part, and we certainly do that. We also focus on the feeling good, which it might be a reconstructive effort that we do after trauma. We help other specialties like orthopedic surgery with patients that have lower extremity trauma, do reconstructive plastic surgery. And then, of course, we do a lot of breast reconstruction. These are patients who've had breast cancer and maybe have had a mastectomy. And we help those doctors that specialize in that in the reconstructive effort. For breast reconstruction. And then, of course, we both also do hand. And when you talk about functionality, our efforts that we do to treat patients, either non-surgical or surgical in the hand world, certainly that's what that's all about.
I want to talk about hands for just a minute, because I think you speak to extremes, if you will, on either side of your craft, because you, Jason, have been here for 20 years. You, Brandon, have been here for 1 year. So anybody who is watching right now who has dealt with hand surgery in the past probably experienced one thing: the evolution of what you can do surgically for hand issues is pretty dramatic.
Oh yeah, for sure. I mean, I think things have come a long way over the years. I mean, we still do a lot of the same procedures that we used to do a long time ago because they work very well, but there's certainly new therapies that have come out, both surgical and non-surgical, that we do that have kind of advanced over the years.
What are some of those?
I think so. One thing that, to parlay off that thought is, for example, carpal tunnel surgery. 20 plus years ago, carpal tunnel surgery was an anesthetic and fairly long procedure with a long incision. And over the years, just to use that as an example, carpal tunnel surgery is frequently done under a local anesthetic or a mild sedation through a very small incision. And Brandon, some of our other hand surgeons will sometimes do it through a tiny little incision using a scope, essentially.
We've been chatting a little bit before we got on camera, so there's some things that you don't always realize as the patient until you're in the office, and then you're very grateful for what you hear. Many of you, if not all of you, are fellowship trained, so that's very important, because doesn't your hand have more bones than any other part of your body? Or is that your foot?
They both have a lot, but yeah. But to your yes, the hand surgeons in our group are fellowship trained in hand surgery, which means we've all done an extra year of training specifically in hand, and then taken the exam to get certified in hand surgery. And so there's Dr. Marshall Jemison, Dr. Mark Brzezinski, Dr. Charlie Rodriguez-Feo, me, and Brandon all are fellowship trained hand surgeons. So we do a lot of that through the Hayes Hand Center, which is what people around town, at least in Chattanooga, recognize.
So I want to stick with the hands for just a second to bring you into the conversation. So let's say it's carpal tunnel. Do people often not recognize the symptoms and then they wait too long?
Yeah, for sure. I've had several patients this year who come in and they really didn't know kind of what was going on, and they just lived with it for so long, and then either through an injection or a quick surgical procedure, it completely changes their life and their function of their hand, and they're very shocked of how easy it was to go through that procedure and wish they'd come in much sooner.
You are both kind of giving me a cautionary warning, because of course we want the viewers to realize that this is what they do here among many other things, and so we're nearing the end of the year. If you're looking to meet your deductible on your insurance, this might be a good thing to go ahead and follow up with. But then you said, but be aware that everyone's trying to do that, so don't wait too long.
Right. Yep. Well, I mean, just call the office or get on our website to facilitate appointments. Sometimes may need a referral and other times not, but our office can help with that. But yeah, I mean, and we see a lot of patients that just make a diagnosis, and not everything that we do in hand or plastic is a surgery. We have fantastic hand therapists. They're right now based out of our Chattanooga office, but will hopefully shortly be out here in Cleveland as well at this office. There's some things we treat with non-surgical steroid injections or a therapy, but we see the patient evaluate, and if that's a route that we're able to do, then we go that way. And if it's something that that needs surgery, well, we're all very experienced in the surgical aspects of the craft, so we might go that direction.
So I think those were very encouraging words probably for people to hear, that it's not a guaranteed solution for you when you walk through the door. On the other types of reconstructive surgeries that you do, you mentioned breast reconstruction. We were just leaving the month of October, which is Breast Cancer Awareness Month. Do you talk a lot with the patient about what she's wanting, and if they want something totally new, great, but if they want it as much as possible, get back to who they were before? Yeah. That's your key?
Yep, and same thing, that requires a consultation, and a lot of it's just education. That we are happy to visit with these patients and go through the options, and there are multiple options for breast reconstruction, ranging from using your own tissue, your own skin and fat and muscle, to using an implant, and so just providing the education so that they feel comfortable with the decision making that they and their surgeon who's doing the procedure for the breast reconstruction, or all can be on the same page. And if it's something they decide to do, of course we spend a lot of time with us and our nursing staff educating, and then go in the operating room and trying to do the best we can to get them back to the look and feel that they want to achieve after going through a breast cancer procedure. Okay,
let's talk cosmetics then before I let you get on with your patients and the busy day ahead. So it's very difficult these days, Brandon, to be a mid-50s-year-old woman and not feel like you can turn back that clock, right? I'm talking about myself here. So the different things that you're able to do at Refined Looks include what? Like, what are some of the more popular things right now that women are coming in for?
I'll leave that with Dr. Rehm. I'm just an orthopedic hand surgeon, so I don't. That's not my field of
He's going to make you feel good about yourself no matter what.
Yeah.
What are they coming?
So, well, injectables, Botox for fine wrinkles of the face, fillers, lips and chin and cheeks. We do a lot of aesthetic skin procedures to help with more youthful appearance to the skin. Laser hair removal, we do tattoo removal, and then in surgery, liposuction and breast procedures, whether it's breast reduction, breast augmentation, or breast lift, and tummy tucks. That's probably our the popular procedures right now.
So on the injectables and on the fillers and on all those things, we're about to enter party season big time, right? Everybody wants to look good for their Christmas pictures and stuff. Do you have a little bit of recovery time from those things?
So. From a Botox procedure, really no recovery. You might have a tiny little bruise on the forehead for a day or two. And the fillers, you want to give yourself a week or two before a big party event because of some swelling and some mild bruising that you might have, but no real recovery period. But to get back to total social party event mode, probably a week or two.
Okay. You also want to make sure that if you're going to do anything, you're dealing with experience, and that's what you'll find here at Refined Looks. So congratulations on this newest office. It's beautiful.
Thank you.
If you're in the Cleveland, Bradley County, Athens area, this might be the very place for you, but no matter where you're watching this morning, they're going to have a location that's convenient. You can find much more at refinedlooks.com. That's their website. That will also take you through to the Hayes Hand Center side if you're looking to have something corrected in your life there, and then the two different phone numbers that you see on your screen.
As life moves forward, we realize that excitement isn't just for the young. and that it's never too late to learn a new trick or two, and that it's okay if life gets a little easier. We understand life may look a little different,